Morning, everybody. Today is Friday, March 21st. I am 1 week out from surgery. Forgive the bright light behind me. I'm sitting right in front of a window, and I'm also in my awesome, neon yellow polka dot spot me from space pajamas. Um, but I just wanted to give a quick update on my back surgery and recovery. Today, I think, is probably the least drugged that I've been since the surgery. So I'm feeling really good as far as recovery goes. I don't know how much details I've given about the surgery. I honestly don't remember much about this last week. The surgery went really well, but it took about 2 hours longer than they were planning, just because when they got in there, the discs are normally supposed to be really soft and really squishy, and mine were very dry and they had basically fallen apart and were like grains of sand. So it took the doctors a long time once they actually got to my spine to pull all the particles of the disc out before they could put the new spacers in. So that's where a lot of the time took. But the doctors were actually really pleased with how well the surgery went. They didn't have to remove any muscle, which they were afraid they were going to have to do. They didn't have to take a bone graft from my hip. They took it from my facet joint and didn't have to use cadaver bone or anything like that because my facet joints were so arthritic. There was lots of extra bone there that they could use. So the surgery overall went really well. It was a big success. The biggest complication came when I woke up from surgery on Friday, not able to breathe very well. My O2 sats weren't staying where they like them to be, and Friday night I started running a low-grade fever. Then by Saturday morning, I was running a fever of about 101, 102. Thank you, Anna. Sorry, I'm getting my morning cuddles with Anna, who's sitting on my lap here. Say hi, Anna. Anyway, so Saturday morning, my fever started climbing higher and higher to where Saturday afternoon it was about 103. And they did an x-ray on my back just to check to see how my back was looking. And on that x-ray, they noticed some spots on my lungs that were concerning. So they ordered a chest x-ray, which I did at like 2 in the morning on Sunday morning. Thank you, Anna. And that confirmed that I had pneumonia. So they started me on really heavy IV antibiotics and oral antibiotics to try and get that taken care of. When I was awake, my O2 sats, which is O2 saturation, which is the amount of oxygen in your blood, would stay right around 94%, which is the low end of normal, but it's acceptable. But when I would start to fall asleep or when I would take painkillers or drugs or whatever, my O2 sats would drop down to about 72%, which is way, way too low. So I was on oxygen basically the whole time after surgery. And the spot that they found the pneumonia was like right up here, right in the upper part of my right lung. Which if it's going to be anywhere, I guess that's the best place to be. The deeper in the lung that it gets, the harder it is to recover from. So we got that addressed, got that taken care of. Hold on just a second. Mom, can we change this? She does not like this one. This one scares her. Sorry, Anna is watching Pingu while I do my video update. Anyway, so as far as pneumonia goes, I guess I had the best type of pneumonia if you're going to have pneumonia. So, but it increased my hospital stay from where they were hoping to have me home Saturday, maybe Sunday, to we weren't even sure I was going to get home when I did on Tuesday. There was talk of possibly having to move me to ICU when my fever was really high and my O2 sats were really low. So it was really scary for a while. But God is good, and He protected me and healed me. And so thank you, everybody, for all of your prayers and your thoughts and your positive energy and everything that you guys are putting out there, because it worked. And today, like I said, I'm feeling really good. I'm 1 week out from surgery. Um, I'm still in quite a bit of pain, but it's all just the surgical incision pain and pain from the screws and rods in my back healing. The bone is trying to grow over those, basically as if it was a break. So that's where most of my pain is coming from. I'm moving around a lot better than I thought I was going to. I'm able to get out of bed and get up to the restroom and even get out of the house for a few minutes every day, which has been a huge sanity saver. But I want to take a minute and I can't say thank you enough to my mom. She has been my lifesaver through this. She has done everything with the kids. She helps me get ready in the morning. She makes sure that I'm taking my medicine when I need to take it. She's taking care of the house, doing laundry, taking care of the meals, getting kids to and from school. She's getting Paul lunch. She's amazing. So thank you, Mom, for everything that you're doing. And I just want everybody to know how much I appreciate her. And also a big thank you to everybody who has brought by meals or sent cards or flowers or has called or sent Facebook messages or anything just to let me know that you're thinking of me. Anything that you've done, no matter how small, it has been greatly appreciated, a big encouragement, and a big help. So thank you for that. The next step is I go today to the doctor in just a couple hours to follow up with my pneumonia, to make sure that that's healing like it should. Make sure my O2 saturations are holding and that I don't need to be on oxygen here at home. So that's our next big hurdle to clear. So just be praying that my chest x-ray comes back with improvement, that my O2 saturations are well into the 90s, and that I get the all clear from the doctor on that. And then I follow up with my surgeon next week. So if you guys have any questions, if there's anything that you guys are wanting to know about the surgery or what I'm feeling or what's going on now, I'm happy to answer those. But I just wanted to let everybody know where I'm at, how the surgery went, and how the healing's going. So thank you, everybody, and I will talk with you soon.